News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. This is part of our series where we're talking with healthcare professionals about how they use the principles of acceptance and commitment therapy with their patients to help improve their lives. We've got a really good show today. Later in the show, we'll be talking with registered dietitian Peggy Knipp about weight management. However, in our first two segments, we're very pleased that Dr. Amy Kahn is here with us. And Amy will be talking with us about tobacco cessation. Dr. Kahn, it's so nice to have you back here on New Skills for Living. Thank you for coming back.
Thank you, Tom. Glad to be here.
And of course, being an old addictions counselor, alcohol dependence just rolled off my tongue. But we're going to be talking about tobacco cessation. And so I'm wondering, can you tell us a little bit about the challenges that people face with tobacco cessation?
Sure, yeah. And actually tobacco, as you know, contains a psychoactive drug called nicotine, and it's very reinforcing in its effects, similar to other drugs of abuse and dependence. So most tobacco users are in fact dependent on nicotine. They have tobacco dependence, if you will. And the addiction itself is very similar to other addictions in that individuals frequently want to quit, but they can't. They have a compulsive use pattern and continue to use despite consequences. And what's different about it from, say, alcohol dependence is the consequences tend to show up a little later. They tend to be associated with lung disease, cancer, heart attack, stroke. But nonetheless, the addictive process itself is at play with people who are chronic tobacco users. And of course, as you know, there's a withdrawal syndrome associated with it as well, which often makes it very challenging when smokers or tobacco users want to quit.
Now, I've talked with people throughout the years who are like recovering alcoholics, heroin users, methamphetamine users. They're still smoking cigarettes. And they're saying, this is the hardest thing to quit, and I don't think I can quit, even though they've addressed those other addictive behaviors. Can you help shed some light on that, Amy, to help us understand maybe what's going on here?
Sure, and a lot of people have gotten sober in smoke-filled rooms.
Yes.
So it's really a very common addiction, if you will. Tobacco's legal in our country. In our state, we have one of the higher than average tobacco use rate, as a matter of fact, compared to the rest of the nation. What's important to recognize is there's a lot of social reinforcement often with tobacco use, which may make it challenging. I think it's one of the reasons why ACT can be so useful in helping persons who do use tobacco to help them quit and stay quit. It's a good time to be thinking about tobacco cessation, particularly since the federal excise tax was increased and went into effect in the first of the month. And I think in Nevada, there's about over $1.80 per pack that's tagged on for taxes. And so good time to be thinking about it. In fact, probably the most important indicator about whether or not someone's going to be successful is a person's desire to quit using. Not that their doctor told them or that their spouse told them, but they actually genuinely have an interest or desire to stop using tobacco.
So, of course, you bring a tremendous amount of experience to this topic as an addictionologist and as the medical director for Concentra Total Care. Can you help us understand, like, what is it that goes on in the mind of a person, Amy, where they do come to that point where they say, I'm stopping, I'm quitting, I don't want to do this anymore?
It's a good question. And keep in mind that like other dependencies or other addictions or other behaviors that we want to change, we may have intermittent thoughts about stopping a behavior, but then that quickly gets interrupted by, oh, I don't have any other choice, I just have to continue to pick up a cigarette or continue to use or what have you. So I think that it's important to understand that it's a willingness and desire to stop using. That's the sort of fundamental requirement. But then beyond that is recognizing that we need help. Choosing not to smoke is important, but then we need to choose to do something else.
Some tools to help one kind of follow through or manifest that decision. Huh?
Oh, absolutely. That's ultimately the bottom line in terms of a person's success.
And there are some tools within acceptance and commitment therapy that you found helpful with patients?
Oh, absolutely. Yeah, I think fundamentally acceptance itself is a very important piece. And in terms of getting to that, just being aware of an individual's triggers. What is the environmental situation or the social context in which a person is using tobacco? What is the pattern of use? And being aware of sort of the external triggers in our life. But related to that is what's going on internally, sort of becoming a detective within oneself and recognizing that there may be certain feelings or certain thoughts or a certain type of a mood, if you will, that may be very closely linked to then using tobacco. That's a real key part of this, is informing oneself and being mindful of those issues that would in fact result in use.
Can you give us maybe some concrete examples of thoughts or feelings or social situations or moods that might be triggers?
Sure. One might just be feeling a little bit unfocused, feeling a little bit spaced out. We know nicotine has the effect of improving a person's attention, and it might be an afternoon break and someone says, I need a cigarette because I can't feel like I'm focusing on what needs to be done. I've got a deadline, what have you. So there's a very close link between that thought and then that behavior which involves using the nicotine. Another example relates to certain patterns like getting in the car and using tobacco, or using having a cigarette after you have a meal, if you will. And what's important in terms of acceptance and commitment training is that once an individual recognizes what is triggering them, is stopping at that moment, committing in the sense of saying, I understand I'm having this discomfort or craving or urge or what have you, but I am going to make a decision based on my values, based on what's important to me, based on what my life is about, to not use tobacco, but choose to get up and get a drink of water, go for a walk, do some meditation, make another choice. And we're not fighting with that urge. We're saying, yeah, your urge, you're there, you're going to go away. But it's basically making a different choice.
Okay. That is some really good information, and after this brief break, we're going to continue to talk with Dr. Khan about tobacco cessation. Hello, and welcome back to New Skills for Living. We're talking with the Medical Director of Concentra Total Care, Dr. Amy Khan, about tobacco cessation. And Dr. Khan, one of the things that I know you just got to briefly touch on, and we want to hear more from you about this, and that's the role of values in people stopping their tobacco use. Can you talk with us about that?
Absolutely. Tom, it's real important that in the recovery process from tobacco dependence, that individuals do embrace what's important to them. What do they see their life as about? What do they want to be remembered by or for? And we know that there is a large number of medical conditions that are associated with tobacco use. In fact, it's the #1 underlying cause of death in the United States. Very much a factor that if one can quit, one's risk goes down considerably. We know that individuals who've had some consequences, whether it be lung disease, emphysema, cancer, what have you, are often very motivated to look at their tobacco use, and often it's a very good time for them to try to quit, and they're often successful at quitting. But some of what being faced with one's own morbidity or mortality does is really help focus up values. What's important in my life? Do I want to be able to exercise with my kids or my grandkids, being able to play ball? Do I want to be able to show up and do my job? We have an aging workforce, and many of us are going to be working longer, and if we are compromised by limited respiratory capacity or other conditions, we may not be able to earn the same wage or perform the same job that we've done. So it's important in utilizing ACT in the recovery process is that individuals do very clearly clarify what's important to them and be thinking about those values as they make choices every day, every moment.
So that rather than being unconscious and just lighting up a cigarette or taking a chew, really be conscious, like I'm engaged in a behavior that's contrary to my real true values in life, and kind of causing that dissonance within the person and making them aware Amy, that they're making a choice?
That's right. It's
Okay.
very conscious.
Okay.
Yeah, and it's tough with nicotine because again, it does have that reinforcing quality as a drug,
Yeah.
and it's important to realize that most individuals, in order to be successful, are going to need some support.
Yes.
This cold turkey method, maybe 5% of people can do it,
Yeah.
and we know people have done it that way, but there are a few other things you can put into place to maximize your
Like
chance
medication.
of success. Medications and social support are key once a person makes
Could you
that
talk
decision.
with us a little bit about those, please?
Sure, absolutely. With respect to medications, there are a number of medications currently approved as an adjunct to treatment as you're trying to stop tobacco use. Probably the most commonly known is nicotine replacement therapy. It could be in the form of gum, lozenges, sort of candy, if you will, patch. And those are very helpful in helping to get through that withdrawal period. Individuals may use the patch or the gum for 12 weeks, 24 weeks while they're going off the cigarettes, if you will, or tobacco use. It really helps in that withdrawal period. Staying quit ends up being the challenge if you haven't gained some of the skills that you need to stay quit. And this is where you need to be able to do other things
Yes.
to manage some of those feelings and emotions.
Yes.
You won't be successful in staying quit.
Yes. So in this last 30 seconds that we have, Dr. Khan, for someone who is at home and they've been wanting to quit either smoking or chewing their tobacco, what would you say to them?
Don't give up. Make a commitment to quit. Get help. Get medication. A couple of the others are varenicline and bupropion, also effective. Know that your life is before you, and you've got a key role in having it be successful and full.
Yeah, yeah.
And you will be successful. Don't give up.
Yeah. Well, Dr. Khan, we want to thank you so much for coming and sharing your expertise with us today. We really appreciate Amy coming back. And after this brief break, registered dietitian Peggy Knipp will talk with us about weight management using the principles of acceptance and commitment therapy. Hello and welcome back to New Skills for Living. In these next two segments, we're going to be talking with our guest, Peggy Knipp, who is a registered dietitian, and she is a health coach, and we're going to be talking about weight management with Peggy today. Peggy, thank you so much for being here.
Thanks for having me.
It's good to have you back on the show.
Thanks.
And so I guess one of the things that we'd want to know is, Peggy, what are some of the, maybe what is the deciding factor that frequently comes up where someone calls you and wants to consult with you about their weight management issue?
Sadly, it's usually the last resort. People will call me or come see me. They say, "Oh, I've tried everything. Nothing's working. I've tried every program out there. I finally decided to come see a dietitian." So it's sadly after they've tried many other, many other attempts at losing weight.
And so maybe just having that information today would be a tip to people that rather than go through yo-yo dieting for years, maybe to seek out your help or the help of another registered dietitian to really come up with a holistic plan when someone is younger and they haven't developed all these things that go on with yo-yo dieting, huh, Peggy?
Absolutely. There are some pretty significant consequences to yo-yo dieting, not to mention the psychological impact of that.
Yes.
But yes, it would be great to seek out a registered dietitian first and avoid some of those pitfalls. And also, just give you the opportunity to really consider weight management and not just focus on weight loss, but managing your weight for life. This is a lifelong journey.
Now, Peggy, when you say that people frequently will call you or another registered dietitian as a last step, does that mean that their health has been negatively impacted, or their self-esteem, or their career, or what are those elements?
Typically, their health, their health has been impacted in some way negatively, and often I'll see them after their doctor said, "You better lose some weight." Oh, what do I do now? I've tried everything else. This isn't working. I've gained weight again. So they
might have symptoms of heart disease or
diabetes. Right.
And especially, I guess, pre-diabetes as well. There are some of the symptoms that a primary care physician would mention to a young man or a young woman that you better go see a registered dietitian before you cross that line.
Absolutely, but often the doctor doesn't say see a dietitian. He or she will say you need to lose weight, and they come sort of lost. Like, what do I do now?
What do I do? Okay. And so I think One of the tools that you use with clients is mindfulness. Can you talk with us about mindfulness and how you use that with clients?
Certainly, it's been very very useful, and it came from the ACT training that you were discussing with Dr. Kahn, and it's really about putting your head in the game, and it's not that it's a game, but realizing that your life is a journey. You're on a journey, and you need to focus on your values, as Dr. Kahn mentioned, and being mindful of those values as you make choices. Unlike tobacco, you can't quit eating, so we have to make you have to make choices about what you're going to eat, and that's about looking at your values.
And so mindfulness, Peggy, if I'm hearing you correctly, it's really about waking up to our lives, and rather than like the unexamined life is not worth living, it's really about like waking up, huh?
It is, and not just waking up, but focusing, staying focused on those values as you journey through.
And so mindfulness is being aware of who we are and the choices that we're making?
Absolutely, and that includes, of course, the choice about what food you're going to put in your mouth, or if you are or not. Okay.
And maybe other behaviors as well that might complement the more explicit nutrition, like exercise.
Yes.
And then maybe some social aspects as well would be part of a...
Absolutely. If you know that you really love ice cream and you're trying to lose weight, is it really a good choice to go to Baskin and Robbins? Probably not.
Well, that's some really good introductory information from Peggy. And right after this brief break, we're going to talk with Peggy more about how she helps clients using acceptance and commitment therapy. Hello and welcome back. We're talking with registered dietitian Peggy Knipp and about weight management. And Peggy, the first thing I'd like to ask you is if you could expand a little bit more on the role that values play in helping people successfully manage their weight.
Well, what I'd like to explain a little bit is how we get to that. We have an exercise that we do, whether in a group or individually. I like to work with people on this in really figuring out what their values are. And we use a retirement party exercise. Pretending you're at your retirement party, what would you want everyone to say about you? You know, as people get up and speak about you and your accomplishments. And that helps people to really focus on what's valuable, what's important, what do I want my life to be about? And so with that in mind, as you focus on that, it's not a goal, a certain weight on a scale, like a goal. That's a particular goal. This is a value, something you're heading toward in life, like on a bus. It's your journey in life. You're the bus driver. And if you're driving your bus toward your values, things are going to interfere. Dr. Kahn referred to this. Thoughts, emotions, feelings sort of get in the way. I can't do this. I had a particular client who kept telling me, I've done this so many times before, I can't do this. And I said, is that really the truth, or is that just a thought? Is that just a passenger on your bus? That's a thought that's getting in your way. Who's driving your bus? And who's heading toward your values? How are you getting there? Is it that thought, or is it you? So
Very
using
nice.
that mindfulness and helping people focus on, you know what, I value my retirement years so I can spend time with my grandkids. That's what I need to focus on.
Yeah, very nice, very nice. So Peggy, can you talk with us a little bit about the resources in the community and ways that you help people then accomplish this goal of weight management?
Well, I'll specifically refer to my own self.
Sure, good.
And I believe my number's on the screen. You can call for, or anyone can call for individual nutrition consultations. I also provide group sessions. Employers can call for their employee group. We have a Fit for Life program, which is nutrition and fitness, Control for Life, which is for diabetes, and we've incorporated ACT training into those programs.
So when you do a nutrition evaluation, can you tell us a little bit about what someone might expect?
Well, initially, you know, we meet and it flows very, very well. Just go through a medical history, a little bit of background if they've had lab results, do a weight, height, you know, basic measurements, waist circumference, and then talk a lot about what are you eating, what are you doing for exercise, and what have you tried before, what's worked and what hasn't worked, because it's so important to figure out if you've done this 10 times and it's not working, let's not try it again. Let's do something else. So we talk a lot about that. And then for the next month, they have access to me via phone or email for any questions, concerns, how's it going, support. I work kind of as a cheerleader or, officially as a health coach to coach them through the process.
Now, I would imagine, I don't know if this is true or not, but I've heard that as we go through our day, if we're not being mindful about our eating, we're going to like take a few peanuts and some M&Ms and we're going to grab this and that. And there are so many things that we've eaten that really we weren't conscious of or aware of. And I guess, is that one of the things that you help people be aware of, Peggy?
I do. That's called distracted eating, and we often do that. And yes, there are little tricks. I have tricks up my sleeve to help people work with that. But it comes back to mindfulness. You need to really be conscious before you put any food in your mouth.
So, Peggy, with the way that you've used your professional training as a registered dietitian and then the principles of acceptance and commitment therapy, could you share with us maybe one or two things that your patients have come back to you and they've expressed some gratitude, or this was really helpful to me?
I have had patients usually email me back and say, oh, I'm so thankful. You know, this is a particular client. It was probably 3 months since I had information or interaction with her, and she emailed me and said, I am so thankful I'm still driving my bus. So she really, really appreciated the bus driving scenario and being in control and being in the driver's seat.
And so she had become aware of how maybe what unconsciously her thoughts have been driving her.
Yes. Yes, and she said to me, she had this particular thought that kept coming back, and she said, you know, I'm just taking that thought for a walk with me now, and I said, good for you.
Rather than letting it kind of run her
Right.
life.
Right.
So, Peggy, let me ask you this. For the people that are out there in this last 30 seconds, that are out there and they're wondering, like, what can they do? How can they get in touch with you, and how soon can you follow up with them?
As indicated, my phone number is on the screen. That's the best way to reach me, and I schedule my own appointments. We can get something set up that's mutually convenient. And at this point, I'm not really booked out too far, so it wouldn't take much time at all.
Okay, Peggy, thank you so much for coming and sharing your experience and your expertise with us. We very much appreciate it, okay?
Thanks, Tom.
All right. And we want to thank you for joining us. I think probably up on the screen is the website listing if you would like to watch this show or other shows that we've had in the New Skills for Living series. We would be glad for you to join us, and we want to welcome you back next month where we'll explore other topics related to acceptance and commitment therapy. Again, we want to thank Peggy for coming in and talking with us today, and thanks to Dr. Khan who came in and shared her experience and expertise. We'll see you next month.